Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for laryngitis. What is laryngitis? Simply speaking, inflammation of larynx is called laryngitis. Larynx or voice box is a musculo-cartilaginous structure lined with mucous membrane situated at the top of the trachea and below root of the tongue, and is involved in breathing, sound production, protection of solid liquid aspiration in trachea. Trachea is windpipe. Mind in laryngitis and pharyngitis, two words are side by side. Pharynx means throat. Pharynx mainly throat. Larynx means voice box. Now let us look at the picture of larynx. This is the larynx. This is larynx. This part is shown just as if it has been dissected, and this is total larynx. These are the two plates with which the sound is produced. It is closed, it is open. When it is closed, it looks like this. When it is open, when we talk, we sing, we cry, then it is open. And this is the trachea. At the top of the trachea, that is windpipe, this larynx is situated. What are the causes of laryngitis? Acute, temporary or vocal strain like yelling, shouting, etc. Microbial infection, that is bacterial, viral, fungal, etc. Chronic, persistent use of voice in singers, public speakers, etc. Smoking, heavy drinking, gastroesophageal reflux disease, chronic sinusitis, scrofullosis. Scrofullosis is totally a term coined from homeopathy. It is not modern medicine. It is not a word of modern medicine. Scrofullosis means the person who imbibe tubercular constitution, tubercular dyscrasia from inheritance. Sometimes flu, common cold, croup, diphtheria, tumor may cause laryngitis also. What are signs and symptoms of laryngitis? Hoarseness, cough, difficulty in speech, dry throat or throat pain, low fever or persistent fever, frequent throat clearing. In children, following symptoms are also seen: difficulty in breathing, swallowing, fever over 102 degrees Fahrenheit, drooling, excessive secretions of saliva, high-pitched, loud breathing sound, malaise. When to consult a physician in laryngitis? Difficulty breathing or difficulty in swallowing continues. Continuous drooling is there. Temperature over 103 degrees Fahrenheit for 2 days. What are risk factors of laryngitis? Professional singers, lecturers, actors. Person suffering from allergies, scrofula. Tobacco smoker or second-hand smokers. Person exposed to chemical irritant allergens. Person having chronic or recurrent acute sinusitis or respiratory tract infection, RT infection, respiratory tract infections. Persons having weak immune or immunocompromised. Persons who are on inhaling steroid drugs. How to prevent laryngitis? Get precautionary measures against infection like washing hands, etc. Use alcohol-based sanitizer in absence of water and soap. Stop smoking and use of smokeless tobacco. Stay hydrated. Use humidifier at home. Avoid all sorts of addiction, caffeinated drinks, rich foods. Is laryngitis contagious? If the cause of laryngitis is microbial infection, then it is contagious. Else it is not. That is, if someone got laryngitis from overuse of, probably like professional singer, overuse of throat, that is not contagious. But if one get laryngitis from bacterial infection or viral infection, that is certainly contagious. Some tobacco, smoking and tobacco in various forms, like modern term has been coined, that is called non-smoking tobacco. Non-smoking tobacco also is part of the tobacco. How to manage a case of laryngitis? For acute cases, restrict smoking, other addictions and solid foods, rest voice, take plenty of fluid, get remedial help necessary. Actually, Laryngitis, if it is caused by viral infection, it spontaneously recovers. Just take some Rex and rest your voice, rest your voice and take plenty of fluid. It will go away within 2 or 3 days. Most of acute cases laryngitis resolve spontaneously. From chronic cases, it is difficult to cure. Control stress, meditation, relaxation, chatting, etc. Get regular exercises to strengthen the immune system. Get regular vaccination against pneumonia, influenza related virus. Get yourself treated with homeopathic constitutional remedy for cure. That is, as a homeopathic doctor, I will always prefer this thing. Go to a constitutional homeopath doctors who treat constitutional with constitutional remedy, that is chronic homeopathic practitioner, chronic disease practitioner. They can do it, not acute disease practitioner. Close treatment. The treatment must be closed with sulfur 1 m 2 doses or maybe high power. 1 dose every evening 2 consecutive days. If constitutional remedy chosen for treatment was not sulfur. Actually, this is, suppose someone is treated with some argentum nitricum, then he has been given some antimonium crudum like this, but he is in chronic treatment. When chronic treatment is pursuing doctor, so doctor must close this treatment with sulfur 1 m because sulfur checks the recurrence of the disease so that the disease doesn't recur. That's why it is written all chronic disease should better be closed with this sulfur. Now the remedies. Antidote for laryngitis. Laryngitis for singers. Voice gone, scarcely able to utter a word. Better from getting overheated in a warm room. Worse after rest. Violent spasms in larynx and pharynx as if throat were blocked with a plug. Phthisis laryngia, that is laryngeal TB, with dry cough. Patient mood, sentimental in moonlight, irresistible, desire to talk in rhymes and poems, disposed to growth of skin like warts, corns, etc. The symptom at the end underlined are always general symptom, that is relates to the person, not the disease. These symptoms are most important. If this symptom matches with the particular symptom of the disease symptoms, then that will be the most appropriate. Otherwise, you put much pressure on these general symptoms. Argentum nitricum laryngitis. Chronic laryngitis of singers, same thing as above. Cough from raising voice, the high pitch cause cough. Hoarseness or loss of voice. Pain, soreness during deglutition. Titillations of larynx with dry spasmodic cough. They are when the patients are fond of sugar, sweet, salt. They are impulsive, do things hurriedly. When looking through a high window, impulse come to jump out of it. These are general symptoms. Most important symptom for selection of argentum nitricum. Hypersal. Great hoarseness with rough barking cough. Scanty tenacious mucopurulent secretions. Difficult to expectorate. Aphonia with little suffocative spasm. Worse in morning and within doors. Aphonia gradually vanishes. They sweat profusely day and night without relief. Crave for sour things, vinegar, acid, strong acid, tasting foods. Sulfur for laryngitis. Voice very deep or hoarseness or aphonia. Worse in morning, subjects with dyscrasia, means various types of disease symptoms. Beginning of trouble after skin disease suppression. You know, skin disease suppression, sulfur is one of the topmost remedies. Also sorinum is there, maybe tuberculinum also come. Subjects feeling hot, cannot tolerate warm weather, like to get undressed, forgetful, like sweets and fat, general symptom of sulfur. Calculated cough for laryngitis. Chronic laryngitis, dry, tormenting cough, mainly at night. After long, great efforts, scanty, white, frothy, gluey, dirty looking, putrid sputa comes actually. Cold and chilliness prevails all over the body. Ulceration of the larynx, lungs of stone cutter, that is very interesting symptom. Stone cutters, affection of larynx and lungs. Calculated cough is one of the great medicine here. Necrosis of cartilages. Necrosis means just destruction of the cartilage of the larynx. Subjects sensitive to cold, catch cold easily. They are dull, lethargic, like to sit idle. Craves eggs, undigestible things like chalk, burnt cow dung cakes, etc. Phosphorus for laryngitis. Violent tickling in voice box while speaking. Dry spasmodic cough with constriction of throat. Night cough from titillation in larynx. Chilliness with cough. Patients crave cold things like ice creams, which agrees. But after getting cold water, it is vomited out as soon as it gets warm. They are restless, apathetic, indifferent, oversensitive to external impressions. General symptoms. Tuberculin for laryngitis, hawk much hot mucus up after eating. Enlarged adenoid tonsils when best selected remedy fails. History of tuberculosis in the family. Anyone parents. Subject patient's symptom ever changing, losing weight fast despite eating well. Calamine laryngitis, very fetid breath, loss of voice, hoarseness with white and viscid expectoration, very appropriate in subacute inflammatory stage with fibrinous exudation and glandular swelling. Fibrinous term has come from fibrin. Fibrin is the white substance, so it generally comes from fibrin. These are white grey coating and the base of the tongue, discharge of white flame are guiding symptoms. All these are fibrins. Calamure always shows that there is fibrin is in the trouble, so it is coming out of the system. That needs calamure. Conem for laryngitis, crawling sensation in larynx with constant irritable cough, lisping voice. What's at night when lying down or after getting fatigue? They sweat day and night as soon as going to sleep, even shutting eyes. Shutting eyes also comes sweat. Despite for warmth, sun, coffee, salty foods. Caliard for laryngitis. Chronic laryngitis, follicular type. Follicular means you can just throw a torchlight in the throat and see there are follicles in the larynx, pharynx area and larynx area. Dry cough with burning and tickling in throat. Secondary tertiary syphilis with deposit in throat. That is, it is an advanced case of syphilis from laryngitis causing from advanced case of syphilis also calls for caliard. Edema of larynx. Edema means swelling with water. Laryngeal thysis also. Divergence of lesion, diversity of aggravation without any prominent feature call for this remedy. This is a peculiar symptom. Please note this. Divergence of lesions, diversity of aggravation without any prominent feature. That is, you don't get any prominent feature to prescribe a particular medicine. Then carry out maybe this medicine. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I will certainly reply.